Good afternoon, everybody. It's 4 o'clock on Thursday. It's the last time we get together each week to remind each other and ourselves that we're going to get through this and we're going to get through this together. And in times that are as dark and difficult as they are right now in the United States and in Kentucky, we need to remember that together we can push through, together we can protect one another, that all of us making good decisions, working our hardest, not getting tired, but pushing back against this virus every day can save lives all around us, all around this state, and all around this country. Today, I want to thank the Model Laboratory Schools for providing this mask. We appreciate everything that they are doing to try to protect their students. All right. So today, we passed some tough milestones, both in the country and here in Kentucky. Let's start in the country. And if you've got kids, this next visual may be a little difficult. So today is the toughest day that this country has ever seen in COVID-19. We lost more people to COVID-19 today than in any other day in our history and certainly our fight against COVID-19. And we're also at a record of hospitalizations across America, meaning that the record we saw today of deaths in the United States sadly might not last for too long. It ought to show us and tell us that it is more important now than ever that we do the right things to protect those around us. And you're going to hear in a little bit when we get into the report that today has been another tough day in the number of Kentuckians that we've lost right here. But as we look at the virus spread in Kentucky, it is Thursday, so we show our incident rate map for the next week. We have 113 of 120 of our counties that are in the red zone. That means that the spread, the incident rate is so high that the CDC says it's not safe out there. That should tell you that we really need to wear a mask, that the steps that we are taking are important and critical, and we ought to push through the end of this week and next week to make the largest impact that we can have on slowing the growth of this virus. Remember, whether it's the experts on the White House Coronavirus Task Force or those at U of L who are doing modeling and projections, they all believe that these steps can and will work if everybody buys in. If we don't try to be the exception or to find a loophole, but we do our part even when it hurts. There's a list of those counties in the red zone that we'll show now, but I mean, it's all but 7. It might be easier to think about the ones that aren't in the red zone, which are Crittenden, Breckenridge, Greene, Adair, Russell, Breathitt, and Nicholas. All right, so that's the tough news about where we are. Let's go back to some good news that we've been talking about, which is vaccines. Remember, we believe that we will have our first set of vaccines pretty close to after the FDA gives emergency authorization. We believe that we could be vaccinating people here in Kentucky as early as December 15th, just right around the corner. And remember, our first shipments, which are about 38,000, about 2/3 of those are going to go to long-term care. CVS and Walgreens is going to do that program. Here is the other third. Today, we're announcing that the other third of vaccinations, which are intended for our frontline healthcare workers, those dealing or exposed to COVID the most, think those working in the emergency room or on COVID wings. We have our first allocation that's getting out there to help vaccinate them once we get authorization. Now, it is a fairly small amount as compared to healthcare workers across Kentucky. So these are just the first 11 sites that are going to receive them. We hope that Moderna has their 70-odd thousand doses, which is at least twice as much as the one we're looking at here coming out 2 weeks later. Not everybody could be in this very first grouping. So the initial allocation sites were chosen. because they were large enough to handle the minimum pallet or size of the Pfizer vaccine that shipped, and that is 975. You can't get a shipment that's less than that. They were selected because the CDC required that they had to have ultra low cold storage. They were selected because they had completely enrolled as a COVID provider, and not everybody is completely enrolled yet. We wanted good coverage area in Kentucky. So you see we have sites in Western, Eastern, South Central Kentucky, as well as some of our most populated areas. And we also looked at high incident rate sites. So here is the list. It's Lourdes Hospital will receive 975, Pikeville Medical Center, 975, University of Kentucky Hospital is getting 2 of the pallets, 1,950. That's 2 of the groups of 975. Baptist Health Madisonville, 975. Baptist Health Louisville, 975. St. Elizabeth Healthcare Edgewood, 975. Baptist Health Corbin, 975. Baptist Health Lexington, 975. Norton Hospital getting 2 pallets, 1,950 doses. Medical Center at Bowling Green, 975. University of Louisville Hospital, 975. So that will be 12,675 frontline healthcare workers that we hope as soon as December 15th can get these first series of vaccinations. And we're allowing each of these facilities to make their own allocations based on tiering that they have done with their staff. They know who is most at risk and have done that analysis. Those still needing to enroll as a provider can do so by our website, kycovid19.ky.gov. It also includes healthcare provider guidance, the Draft Kentucky Vaccination Plan, which has our planning phases in it, critical populations, and vaccine provider enrollment and administration. So there are a limited number that we could include in this very first shipment. We did our best. Those that are not receiving it, I know very much want it to protect their individuals. We are going to be further spreading this out in future allocations. This is in many ways our test run, the very first time. So our plan is to get these 11 providers on the phone with everybody else that's looking to be a provider so that we can learn from their experience in this first time, so that 2 weeks later, when additional facilities get the first shipment of Moderna, we hope, that's a projected timeline, that we can do even better than this first rollout. But remember, even if you're not a part of this very first shipment, it's exciting that there is a shipment of a vaccine that looks to be about 94% effective. The hard thing is that's so exciting, it's going to be very difficult to be patient, but we need to be patient. And that includes both other healthcare providers, different parts of our population that sure are at risk. We have a very limited quantity right now. We're going to make sure that those most vulnerable in long-term care that make up about 66% of all of our deaths have first priority, along with our healthcare workers that are in there caring for COVID patients right now. But really a truly exciting day that we've now have this plan down to the point where once they give the approval, the shipment goes, and we know that this is happening, and the light at the end of the tunnel just got a little bit brighter. And again, it all depends on the number of vaccines, how effective they are, and how quickly they can ramp up manufacturing. But we see an end, and my hope is that our timetable actually starts shrinking in how long we believe it'll take to get those who want to be vaccinated vaccinated. All right, the reason that we need those vaccines is this virus is in uncontrolled spread and it's deadly. So today we're reporting 3,895 new cases of the coronavirus. That is our second highest day that we have ever had. It's the highest Thursday that we've had. Today we've also got 34 deaths. That's our third highest day. Yesterday was our highest, and the day before was our second. So we've had our 3 highest days of COVID fatalities all in a row. And we've had 118 deaths since Monday alone. That's a lot of families that are going to need our help, that need our compassion, that need those green lights they can see when they're driving around, that need those bells at 10 a.m. We also had 416 kids test positive in today's report. The percentage overall has grown so much of kids in our overall cases. We're now at 190,601 total cases. This part's tough. We're now over 2,000 deaths at 2014. Again, 2014 Kentuckians that we have lost to this pandemic. They and their families are the reasons that we ought to fight harder each and every day. Our positivity rate now at 10.07%. And I will tell you on the Johns Hopkins website, which again doesn't take our most up-to-date data, we're getting pretty close to qualifying for our own travel advisory. That should tell you where we are and how concerning it is out there. We have the highest number of Kentuckians ever hospitalized, 1,810. That is up 42 from yesterday. 415 Kentuckians in the ICU, 240 fighting for their lives on a ventilator. Next part is the hardest that we do. Today's deaths, 34 of them, and who they include. Again, we're seeing more people in their 60s and even in their 50s and some in their 40s than ever before. So they include 3 individuals from Barron County, a 69 and a 63-year-old man and a 65-year-old woman, an 86-year-old woman from Bell County, an 87-year-old woman and a 93-year-old woman from Caldwell County, a 71 and a 76-year-old woman from Christian County, a 50-year-old man from Crittenden County, a 96-year-old woman from Davis County, an 81-year-old man from Fayette County. Fayette County also has a 95-year-old woman, a 65-year-old woman, a 96-year-old woman, an 87-year-old woman, a 94-year-old woman, a 93-year-old man, a 90-year-old woman, and a 78-year-old woman. Our prayers are with the Lexington community, hit very, very hard today. Also lost a 101-year-old woman in Graves County, a 64-year-old woman in Greenup, a 69-year-old woman in Hickman, and in Jefferson, a 94 and an 82-year-old woman, 62-year-old man in Marion, a 94-year-old woman in McCracken, 76-year-old woman in Metcalf, 88-year-old man in Oldham, and a 91-year-old woman. And then in Warren County, 88-year-old man, 74-year-old woman, a 92-year-old woman, and an 84-year-old man. Finally, a 68-year-old man in Woodford County. New cases by county, as always, can be found at kycovid19.ky.gov, but 683 in Jefferson, 373 in Fayette, 147 in Hardin, 132 in Kenton, 110 in Boone, 103 in McCracken, 97 in Warren, 84 in Davis, 81 in Madison, 71 in Bullitt, 65 in Perry, 60 in Graves, 59 in Campbell, 59 in Greenup, 54 in Christian, 51 in Hart County. Rest of them can be found on kycovid19.ky.gov. Today we also have another example of the fact that these aren't names and genders and counties, they are people. So today we're remembering Aretha Tilford. This past weekend, Kentucky lost Aretha Tilford to COVID-19 after 25 days in the hospital. She was 57 years old. Her husband of 22 years, Mark Tilford, said, Aretha was a queen. He described her as the love of his life and the most unselfish, charismatic person he'd ever met. She was the life of the party and lifted everyone up who knew her. This was apparent as we heard from those who knew her. As an attendance clerk at Lincoln Elementary Performing Arts School in Louisville, Miss Aretha touched the lives of every child who walked through that school's door. She always said, when you can't find the sunshine, be the sunshine. And she lived that through every day. On the 3rd of November, Mark took his wife to the hospital where he had to leave her at the ER due to COVID restrictions. A couple hours later, she called him saying she was going to have to be put on a ventilator. This was the last time they were able to speak. After fighting for 25 days, Aretha passed, leaving Mark and everyone who knew her devastated. The outpouring of encouraging messages of love and support during the battle from students, parents, friends, and more highlighted how many lives she touched during her time on Earth. When we spoke to Mark, he stated he can't speak to what people should or shouldn't do because he is only one of millions mourning a lost loved one to this virus. But he wanted to know his wife, Aretha Tilford, was the most beautiful person inside and out. Aretha is now looking over her husband and their 2 sons. Our thoughts and our prayers are with her. We are so thankful that she was shared with us today, and we are so thankful for everything that she has done. And to her family, we are so sorry. Long-term care facilities continue to show you why they are a priority and how we are distributing the vaccine. 247 new residents testing positive, 184 new staff, and 15 new deaths. All right, shorter report today. We're going to move directly into questions. I have some written, and we have a number of journalists on the line. So let's start with Mike Valenti from WLEX.
Governor, thank you. I assume that your administration is operating under the assumption that this will be the Pfizer vaccine, correct? So that's a 2-shot vaccine. So that means 12,000 healthcare workers will have enough for 2 shots 3 weeks apart.
So this is the Pfizer vaccine, and you're right, it is 2 shots. The Moderna vaccine is also 2 shots, the initial and the booster. What the federal government is doing is it is holding that second dose, which it has on hand, which it will ship out at the appropriate time. So these are 12,000 plus individuals that are getting their first shot, but for each of the 12,000, the federal government has or is supposed to have the booster shot in hand. So in each of these times when we talk about the doses coming out, at least the initial doses will all be the first, but we'll make sure to delineate how many of them are that booster that is coming. But for the numbers we talk about for Pfizer right now, even in the long-term care, so that if you combine them, that 38,000 are all the initial shots where the federal government's supposed to have the booster. And the Moderna is going to be, we think, 70+ thousand again, just that initial that initial dose with the second one being held. Shelby Smithson, WKYT.
Hi, Governor. We're nearing about 2 weeks since the indoor dining restriction. So what kind of impact are we expecting to see, whether gradual or immediate, and when?
So we will see at the end of this week, certainly where we were compared to last week. We already expect that the growth week to week, or if you look at the last couple, is going to be less severe than the week before. So when we look at that stair-stepper chart on Monday, we'll start, I believe, seeing a little slowing or at least lessening of the severity of the slope itself, the growth. So I think we're hopefully starting to see some of that. Sadly, we have to slow it down before we can turn it around. So what we want to make sure is we're not going now from we hit 4,000 to 5,000 or to 6,000, and then also looking at our rate of growth potentially about others out there. We do anticipate, because we will have been through multiple life cycles of the virus when it can spread, that in-person dining at that 50% level will be able to open back up on the 14th with a renewed commitment on the mask mandate. Because we definitely got to a point where originally, and this is all across, this isn't just dining, we had really good enforcement, even when it was tough. Then I think we reached a point where people got tired of being yelled at. Nobody should be yelled at for enforcing a mandate, and ultimately said this is on the individuals. The problem is if you're a place that people come in and take off their masks, if you are not enforcing it, you're exposing everybody else there to that person's noncompliance. So when we reopen, we do need a very strong commitment in these facilities to enforcing those rules. And I tell you what, we've seen in the past, if we do that, that keeps the virus under control to where we don't have to take other steps. Joe Ragusa from Spectrum.
Hi, Governor. As we're talking about the announcement today with the vaccine distribution to hospitals, I want to ask about the flip side of this first rollout with long-term care facilities. I imagine the distribution plan to long-term care facilities is going to be a lot more detailed in regards to how you're shipping those out. But can you speak to how that's going to happen? As I imagine it'll coincide with this distribution to hospitals.
So the federal government has entered into a contract with CVS and Walgreens, who are going to do all of the long-term care facilities. So what we do is we activate the program as soon as there is emergency authorization. And so what they then start doing with the amount they're going to get, which is that 2/3, is they start scheduling the long-term care facilities. And we'll be communicating with them, but the logistics and the scheduling on this will fall primarily on those two companies as the federal government is contracted for them to do. We believe that it is possible, and we certainly hope that we can get the 50,000 or so individuals and workers in the most intense tier of long-term care vaccinated potentially in the first 8 weeks of the program. That is our hope. A lot of it will be based on CVS and Walgreens and what their abilities are once we see them on the ground. But those are the two companies that we have to use for this, but our initial calls have been pretty good with them. James Pilcher.
Good afternoon, Governor. Follow up on the restaurant issue. As you know, several restaurants have had their licenses pulled and are continuing to operate. What else can be done? I know it's been referred to the county attorneys in some of those cases, but nothing seems to have been done besides the orders and the license being pulled by the health department. What else can be done, and what can you be done? As a part two to that, have you heard anything whether the U.S. Supreme Court is going to take up the AG's appeal? Thank you.
So on the restaurant front, if you're still operating, it's a real issue of rule of law. If the laws in the country only mean something if they're not harmful to you, and if we're setting a new standard to where we only have to follow them unless the consequences could be bad to us, then we're going to see some real concerning behavior moving forward across all different types of sectors and challenges we face. Fighting a virus isn't easy. It isn't easy. And the virus is mean about where it chooses and what impact that it has. I mean, look at other industries. Look at the tourism and the hotel and other industries that have been just decimated. But they know it's not a restriction. They know it's what the virus does and how it spreads. And so it takes uneven sacrifice that, again, isn't fair. But if you're operating right now, especially during this period of time where the surge is uncontrolled, number one, you're not doing your part to defeat this virus. And number two, you are allowing further spread where you make it possible that the federal government could suggest even tougher things down the road. We don't need that. We know we can stop this with everybody doing their part. We're trying to treat everybody in that industry equal, and we need people to say okay and get ready for the 14th and not try to be the exception. Certainly in Fayette County, they took one restaurant to court. They got an order closing it. I'm told today that restaurant's now trying to find a way around it, has a food truck outside, and is letting people bring food inside and eat it with their masks off. In other words, they found a way that they think gets around it where they know they can spread the virus. Good luck with the liability on that. given the orders are out there and the knowledge that's out there. Our response to the Supreme Court is due on Friday, and we'll see what they do from there. Clarification on schools returning to class on Monday. Is it recommended or required that elementary schools remain NTI if their county is red? Pursuant to the order we put out and based on input from the Kentucky Department of Education, the elementary schools that are red will stay in NTI. The 7 counties that are not will have the opportunity to hopefully on a lower capacity basis return to in-person classes. I will say that we are working right now diligently on ways that we believe that potentially even in red counties, schools can go back to some form of in-person learning as soon as January 4th. What we have to do is ensure that those employees who go into the building, who are really at risk, have the type of safeguards that they need to keep them safe. We also need to make sure that there are virtual options for every class in every school, and we don't end up in a situation that we saw before, where some schools would say, okay, we have a virtual option, but there are no AP classes, and there are no these classes that you may need to graduate. It's got to be meaningful and real. Tom Latek with Kentucky Today.
Good afternoon, Governor. I will assume that the dry run for vaccine delivery went well from what you're saying today. And secondly, why so many cases in Hardin County? Is there an outbreak at Fort Knox?
We'll have to get back to you on the Hardin County and whether that's Fort Knox, but we've seen significant spread at different times in Hardin County. Hardin County has a larger population than many counties that are out there as well. But we've seen these, I mean, we've seen it grow very quickly in certain counties, and then it'll lessen a little bit and grow again. I mean, if you look, McCracken County has had, its population is certainly less than Hardin County, and it's had over 100 cases for 2 straight days. So we'll check on the Fort Knox piece, but right now we believe that this is just community spread that is that bad, even in some other counties that we mentioned, where the population isn't all that large comparatively. Trevor Peters, Fox 19, because the Pfizer vaccine is incredibly sensitive with temperature, are we concerned some of the limited doses could go to waste due to human error? Not in this initial round, because they're being handled by 2 sophisticated companies for long-term care that should have the ability to do this. And then everywhere else we're shipping, those 11, the actual locations we're shipping to have the deep refrigeration that's necessary. In other words, they don't even have to do the replenishing of the dry ice or find other ways that they can keep this thing safely stored at their facility. Now, the other reason we're not as concerned about waste with the first round of shipments is there's just not enough of them. I mean, they're going to be able to very rapidly give these vaccines to those that are willing to take it. Now, this leads into kind of the second question of what are the biggest concerns about how we could slip in the vaccine distribution? What keeps us up at night? That's more of when we have the really good problem of having a lot of vaccine, right, that is being distributed in large numbers. And then it's getting it to providers in the right amounts to where, again, they can provide it to people and there can be no waste. And then it's when we have enough and we start being able to open it to more and more folks, being able to communicate why certain groups may get priority when everybody wants to get past this and wants to get the vaccine. The asking for patience in a very difficult situation. The thing that keeps me up at night is if we suddenly get a really big shipment and we don't have people lined up, in that next 24 to 48 hours to get the vaccination. I want to make sure that as efficiently as we can, we get people vaccinated as quickly as we can. So not wanting for another month to pass when we have some of this on hand, knowing that we could have saved somebody. Part of the concerns on how we could slip. We're also going to learn as we go. That's why we're having these first 11 do their program and then come back and talk to everybody else. We're going to try to really learn, and we'll be transparent about what we learn as we go. So if you're maybe a smaller provider that may be in a third or a fourth round that comes out, you'll benefit from all the knowledge of everybody who has learned on the fly while doing this. Stu Johnson from WEKU.
Hi, Governor. You've talked a number of times about what you see as the need for more federal funding. When push comes to shove, do you think that Congress will act by the end of December on another round of funding? And there's also been talk out of Washington of some now and some in early 2021. But I guess the first question is, do you think there'll be action by the end of the month?
I hope so. I really hope so. It's hard to have faith in Congress acting after we've needed it for so long. And remember, with all the different things we do, we have to give certain notice. I mean, if we're going to stop using a lab, they've got to know a couple of weeks in advance. And with funding running out December 31st, we don't need them to act in December. We need them to act tomorrow. So I very, very much hope so. We're trying to make contingency plans on how we could get through January, if that buys some more time for them to do the right thing, because we just can't let everything it takes to fight this virus fall off a cliff. I mean, if people don't have a test they can get, they won't know if they're positive. If they're positive, they can't get a call that tells them the things that they should or should not do. Then the virus spreads even more. Some now, some later. I will take what they will do right now. I do have some concerns that if there aren't new additional dollars for testing, that some states burn through their CARES Act money, and we I believe have spent it wisely. And if they just do an extension of what's been provided, we may be able to use that to get through another month or so. But there are going to be other states out there that are totally wiped out. So in the very least, do funding for testing and for contact tracing, for vaccine distribution. In the very least, do the things that we have to do to fight the actual virus from infecting and killing people. That should be a no-brainer. But the other no-brainers are businesses out there that are hurting, that the White House Coronavirus Task Force tells us to restrict at certain times, like bars and restaurants and gyms and event spaces. Let's make sure that they are in this round of CARES Act funding because they've had to sacrifice the most. Let's make sure that individuals out there who are suffering, who we at least can extend unemployment for, get help. Let's make sure those that didn't make a lot before this, that suddenly don't have a job, can get a little extra help on their unemployment as well. You know, it worked when it was done last year. Let's give credit to Congress and this administration. Those dollars flowed through the economy and they helped us weather part of this storm. But the storm's going to continue until we can get everybody vaccinated, and we're going to need the continued help of the federal government. Another small business has closed its store in Pikeville for good. Bank 253. In a post on Facebook, the restaurant blames the reason for closing permanently is due to Governor Beshear's mandates and restrictions on restaurants throughout the pandemic. What's my response? Sadly, these are the places, nightclub in particular, that the virus spreads. That's not my conclusion. That's Dr. Birx, Dr. Fauci, Dr. Stack, and doctors at Stanford and Northwestern. That's what we have empirically shown in how we stopped the first two surges, especially the summer surge. It's what was empirically shown in the steps that Texas and Arizona and Florida took to stem their increases. It is not debatable, even though there's disinformation out there, that these are steps that are effective in stopping the exponential growth of the virus. If we hadn't taken these steps, a lot more people would have died than what we are going to see. So to Bank 253, I didn't take the step lightly. I did it to save lives. And the White House task force says we are going to save lives through doing it. I hate that that sacrifice is borne more by you than by many others. But it's a decision that I believe I had to make, and that I would make again based on the irrefutable scientific evidence and advice that we've received. Julia Hunter from the Hoptown Chronicle.
Hi, Governor. Thanks for having me. My question kind of follows up on the question before, the one you just addressed about federal funding. With the state funding possibly disappearing for local contact tracers, can you speak to what kind of adverse effects that we could expect without a centralized tracing effort?
Yes, and first let me say our local health departments, even before the additional contact tracers, have been incredible. But they would be the first to tell you that there is so much work right now that even those extra 1,000+ people we have helping are not enough, because our local health departments don't just do contact tracing; they do testing, they do enforcement. I mean, they're asked to do it all. I had a conference call with them today, a Zoom, just to tell them thank you for everything you've done. Thank you. I mean, they're out there saving lives, and people are yelling at them and making threats, but doing the right thing's supposed to be hard. And I told them that I feel a little bit of that too, and we're going to make it through together. And we're going to know, looking back, we did the right thing. So if there's no additional money for contact tracing, a couple things will happen, and both are the result of further spread of the virus than we would see if there wasn't contact tracing. So somebody who tests positive will not likely get the call and the advice about what they should and should not do. So for instance, they may think if they're positive, but they put on a mask, that they can go to a grocery store, that they can potentially send their kids back to school, that those in their household don't have to quarantine, even though we know it moves through the household really quickly. In other words, there will undoubtedly be lots of people who will take actions after being positive that they otherwise wouldn't have, simply by not knowing, and that will spread the virus further. The second piece is there'll be nobody to call anybody that positive person has been in contact with. Now, right now we're overwhelmed, so we can't call them all, but we are calling the most vulnerable. But here, the most vulnerable won't even know that they were potentially exposed. Those that might be exposed, might suffer the ultimate worst result, won't even know that they need to go see their doctors. So what you'll see is more spread and more death. Contact tracing, we always talked about, is most effective when there are a lot fewer cases. But what's most effective is a different question than what is absolutely necessary. And I'm just not willing to abandon our people who test positive. And without having contact tracers to at least call them and talk to them when they're positive, that is abandonment of people when they need our help the most. Alex Aquisto, I'm sorry, Alex, from the Lexington Herald Leader.
Hi, Governor. That's okay. I have a question about statewide hospital capacity. So right now, there's no way of knowing if a community is running out of hospital beds because of how the state is releasing those figures. As far as I can tell, the Kentucky Hospital Association uses Department for Public Health data to update their dashboard weekly, or intermittently rather, because sometimes it's not even weekly. But even then, it's only statewide figures. And so, for example, yesterday, 78% of ICU beds are filled across the state, but there's no way of knowing which hospitals have what amount of beds. And so my question is, you said yesterday many of our healthcare systems are stretched to the brink. I'm wondering if you think the public deserves to know if the hospital in their community is running out of beds, and if so, how is your office going to make that information available?
Well, sure, a community deserves to know if their hospitals are running out of beds, and I believe that the hospital systems have been pretty good at sounding the alarm when that's happening. We saw it with King's Daughter. We saw it with Med Center and Bowling Green at different points. Let us see what we can do. One challenge we face, and it's understandable, is that during this pandemic, there's lots of different data that people want to see. And every time we get a new set of data we want to provide, we got to take people off the jobs that they are already doing that are necessary to to get there. But let's see what we can do with the data. If it's readily available, we certainly want to provide it, and we'll see what it would take to get there. We'll also see what the local ability on that is. Debbie Yetter with the Courier-Journal.
I wondered if you could describe if you know how hospitals plan to designate who among their staff gets the vaccine on this first batch, and will it be direct shipped to hospitals by?
It is going to be direct shipped to the hospitals, and my understanding is that each of these systems and/or hospitals have already tiered their workers in the level of exposure or likely level of exposure that they have. Certainly the first two that we expect that any hospital is going to provide it to is staff in a COVID wing and staff in the ER. And then they're knowledgeable about which other groups come in contact with their COVID patients, certainly a lot more than we are. And that's one of the things we're going to be able to look back on after this first set of shipments. But I was talking to at least one major system CEO, and he was talking about how they'd already gone through and they could break this down to a pretty granular level. And if we told them the amount they were getting, they would know exactly which employees they were. And each of these systems, to my knowledge, have already gone through and determined who is willing to take it. So that's one of the advantages of being able to do some of the healthcare workers first, is that they already work in a system that has the most knowledge on who's most likely to contract the virus and be exposed. And I actually think we can learn a lot coming out from it about the next steps we take and how we provide the vaccine to other populations. Josh James from WUKY.
Hi, Governor. I was curious if you have any updates on your administration's contact with the incoming Biden administration, and are there any indications that rocky transition might affect the rollout of vaccines or any other help in Kentucky?
Let me start with the second piece of that. We have not seen any impact yet on rollout of vaccines. I'm not sure if there was going to be, based on the rocky transition, we would see it yet, though. We're still dealing with really the first shipment and the second expected shipment. I would think that the impact would fall sometime after that. Admittedly, we haven't had much communication, much reach out from the Biden transition team, but they're doing a lot, and they've got a lot in front of them. We do expect to have more. We certainly do have a contact that we can communicate with, and we're expecting that to pick up as we go. He has talked to the NGA, the National Governors Association. We did have a call with the representatives from that association that he spoke with. They did carry the most important messages, certainly from us in Kentucky, dealing with the vaccine, dealing with federal funding, and the challenges that we face. John Boyle from WFPL.
Hi, Governor. I wanted to go back to restaurants. So you said again today that you don't plan to extend the restrictions and that 2 cycles will have passed by then. But will only be about 1 cycle after Thanksgiving, which health officials have said could lead to a surge within a surge. So some restaurant owners have already told me they're hesitant to believe the restrictions will be lifted. So I wanted to know, when will there be a definitive decision on this so business owners can plan accordingly?
We fully expect to not renew that piece of the executive order, and for restaurants to be able to reopen on the 14th. I can only say it so many ways. Could something crazy happen before then? Potentially, but again, we don't see any extension right now of the closing of in-person dining. Again, we do need a lot better enforcement of the mask mandate moving forward, and if we get that, I mean, we can continue to have a real positive impact. We will be since it's the 14th, about 15 plus days post Thanksgiving. And of course, we think because of the steps we took, our Thanksgiving surge will be smaller than other states. But certainly we need people to follow the CDC's guidance about what to do if you did get together with people for Thanksgiving. Also, we are renewing the mask mandate. That is happening today. And there is an additional mask application that deals with gyms that were previously not required. But what we have seen in other states is that can be done safely for most people. All right, thank you, everybody. We're going to get out a little bit early today. I need everybody to be safe. Wear your mask, engage in social distancing to protect yourself at this point, to protect your family, and to not bring it home to those you love. But also do it to protect everybody else in that community. And in the end, if it's self-preservation or if it's loving your neighbors yourself, either way, it will help us beat this virus. These next couple months nationwide look like they're going to be grim. And they can be and may be grim here in Kentucky. But we can do something about it. Again, we are taking active, aggressive action. Surrender is not an option. Action's tough, inaction's deadly. So if everybody will do their part up to the 14th, do their part after the 14th, and everything else we have in place, we can save lives. So we're going to get through this. We're going to get through it together. We'll see you Monday at 4 p.m.